So here we are going to learn a few questions. So first question is, which of the following is bivalent meningococcal vaccine? So meningococcal vaccine can be bivalent, trivalent, tetravalent, ACYW, that is tetravalent, and then bivalent is AC, trivalent is AC and W. So the answer is AC. Then next is 23-year-old sexual worker presented to hospital after coming in contact with an HIV positive male. So just read the last sentence. What is the minimum period for post-exposure chemoprophylaxis? That's 4 weeks. You have to start post-exposure chemoprophylaxis in as early as 24 hours. Maximum you have to start in 72 hours and it continues up to 4 weeks. So 24 hours, that's the golden period. Okay, this one is the golden period. Next question is, just read the last. Which of the following is responsible for patient's condition phonation? What is the phonation here? It's a rough, low pitch, unpleasant voice. So it is not true vocal cord, it is false vocal cord. Next, involvement of which of the following cord paralysis is life-threatening? So life-threatening occurs when bilateral abductor paralysis. Only 2 is correct. That is, what is the abductor? It's a cricoarytenoid, cricothyroid. So it is posterior cricoarytenoid, and when the vocal cords are abducted, then only the airflow occurs. Okay, so here what happens when there is paralysis? So it will be in the median position. So what happens? There will be dyspnea. The next question you can see about about a child. Head circumference is enlarged and inspiratory stridor. Herniation in the back, there is a herniation, meningomyelocele. So here you can see in the MRI of brain, there is displacement of midbrain, fourth ventricle and cerebellar tonsils through foramen magnum. So this is, Dandy Walker is posterior fossa cyst. Here you are having Arnold-Chiari malformations. So it is Arnold-Chiari is related with congenital vocal cord palsy. Arnold-Chiari is of 2 types, type 1 and type 2. So type 1 is having, you can see this meningomyelocele, syringomyelia, all these are associated with this. Type 1 malformation. The next question is about epistaxis. So epistaxis, and you can see an attempt to block the external carotid artery is made, does not lead to resolution. So it is from internal carotid artery. So internal carotid artery, the epistaxis. Little's area is from greater palatine artery, anterior ethmoidal, superior labial branchofacial artery and sphenopalatine gas. From this you can see internal carotid artery is supplying which? Anterior ethmoidal. Okay, ethmoidal is from internal carotid, anterior ethmoidal and posterior ethmoidal, but anterior ethmoidal is contributing to Little's area. So that is the answer. Then next you can see this question is about a woman, 30-year-old woman. She's taking medications for depression, and then you can see after the delivery she forgot to tell psychiatrist and continued to take the drug also. Okay, even in pregnancy. So what happened is after delivery she is not able to feed. There was no lactation, not able to feed the baby. So which drug was antidepressant that could suppress lactation? Answer is amphetamine. Next question is about you can see the picture also as a 6-month-old male child, and here you can see the rash. So is complaining of a rash. Okay, and it started appearing on the trunk. So you have a lot of answers in your mind, and it is spreading to arms and legs, and there is a history of fever, seizure 3 days back. So now there is no fever, seizure and all. Okay, so what is the diagnosis? There was fever with a rash. So this answer is erythema infectious. So that is slap cheek disease. Okay, this is exanthum subitum, roseola infantum. So this is actually roseola infantum. So roseola, you have to remember when the fever subsides, rash appears. In case of measles, it is both together, measles or rubeola. This is roseola infantum, or we call it as exanthum subitum. Another name is sixth disease. Okay, next is, and you can see the first appearance is in the trunk. So in measles, it would be behind the ear. Okay. Next is you can see which is a condition where tadalafil is contraindicated. So this is a phosphodiesterase 5 inhibitor, and when we are, it is contraindicated along with the nitrate. So that happens in which case? Acute coronary syndrome, we already gave nitrate, so we do not want to give tadalafil in that case. Next is about Weber syndrome. So Weber syndrome is like Weber and Benedict syndrome. Okay.